Last year, Healthwatch Suffolk conducted a survey of 12,000 young people in Suffolk to find out more about their emotional health and well-being. Part of the survey asked about self-harm, so I'll talk you through some of the key findings in this area. Amongst young people aged between 11 and 19, we found that 13% of boys and 22% of girls said that they had self-harmed at some point. Before they answered this question, they were shown a definition which explained the various behaviours that can be counted as self-harm. Between the ages of 11 and 19, self-harm rates amongst boys remain fairly stable. Amongst the girls, however, we see a sharp increase between the ages of 11 and 16. By age 16, 1 in 4 girls told us that they have self-harmed. The data also highlighted that certain groups of young people were more likely to have self-harmed. Those young people who identified as LGBT were 5 times as likely as their peers to have self-harmed. Children in care were also more likely to have self-harmed, with 1 in 3 saying they'd done so. On average, those young people who told us that they had self-harmed were much more likely than their peers to report having an existing mental health difficulty. On average, their well-being was also poorer and they were much more likely to have low self-esteem. When it came to seeking support with self-harm, almost half of young people who currently self-harm told us that they don't know where to go to get that help. 3 in 5 also told us that they wouldn't feel comfortable approaching mental health services for help, and a further 2 out of 3 told us that they wouldn't feel comfortable speaking to their parents about the issue. If you're interested in finding out more about this project and some of the key findings, these are all available on our website where you can download the full report.